contains data on data and also AI competencies needed to strengthen the African health system and also improve the delivery of care within Africa. They do this as well through community-driven capacity building programs, such as instructor-led trainings and programs and leadership boot camps as well. And they do this with the aim to empower early and mid-career healthcare professionals to become leaders and innovators in digital health. Healthlytic, on the other hand, is a Nigerian-based digital health social enterprise dedicated to building Africa's digital health ecosystem, inspiring also the next generation of data-driven and digitally enabled healthcare leaders. And we are excited to be bringing this session today to mark and also celebrate the Global Digital Health Week, alongside several other digital health organizations as well, looking to renew their commitment to building that healthcare, digitally enabled healthcare workforce that we all hope to see to achieve a connected healthcare system. And next thing here I just have is a very quick icebreaker section activity. If your hands aren't busy, kindly just use the Zoom chat to tell us what country you're joining in from and which of the countries that we'll be discussing today that you're interested in learning more about the digital health strategy. Just a bit of context, the session theme today is a course learning on national digital health strategies across Nigeria, Kenya, and Ethiopia. And we are hoping to learn from both the successes and the challenges across these different countries to advance or progress digital health initiatives across Africa. So again, just tell us what country you're joining in from and which of the countries that we'll be discussing about today that you are interested in learning more about their digital health strategy. For a quick example, you can say, hi, my name is Obina. I'm joining from, you can put in either the name or you can just put a flag to just say, oh, I'm joining from Canada. I'm joining in from Ethiopia. I'm joining from Uganda or any of the countries at all. But I would love to learn more about the digital health strategy of Nigeria. So feel free, do that within the chat. I can just quickly read out the first few participants who may have dropped theirs as well on the chat as well. And while you're doing that, I'll just keep going with the slides for interest of time as well. Just to give you a big idea about the objective for today's session. First, we are looking at the goal of today's session is to share experiences and challenges in developing and implementing national digital health strategies, like I earlier mentioned. And we also hoping to explore opportunities for regional and global collaboration on digital health strategy alignment across Africa, but also within and across Africa, actually. But at the same time, we're also hoping to generate actionable recommendations to strengthen strategy design and implementation for these strategies across the several other African countries as well, those who already have and also those who are in the process of designing or implementing, a digital health strategy. And that being said, just to give you an idea of what to expect from today's session, we've just gone through the first 3 points here, and the next slide I'll be presenting will just be a very quick introduction of the panelists and the moderator for today's session. And for the panel session, next we'll have the panel session actually, which would run for the next 30 to 45 minutes or so. And we'll end up with a Q&A session with from the participants as well. So as the panel session is ongoing and the panelists are responding to the questions, please drop your questions on the chat. Myself and the rest of the DHSA team as well would also be in the chat to respond to any of your questions, and those which are not addressable on the chat would also be addressed by the panelists during the Q&A session, and then we can just have a very quick wrap up. For the first panelist that we have today, we have Dr. Kunle, and Dr. Kunle is a public health physician and a global social impact expert with 15 years of experience advancing digital health systems. He's also a former USAID technical lead, and he had directed a major US paper program in Nigeria and founded AI for social impact and development. He's also a managing partner at the Africa Hub for Innovation and Development. And we are fortunate to have Dr. Kunle today to talk us through Nigeria's digital health strategy. And next we have Dr. Abel. Dr. Abel is a physician and a digital health innovator shaping the future of healthcare in Africa. He founded the Digital Health Digest and has held several leadership roles within Mobile Health International and Chemonic, Chemonics International and Orbit Health. He also co-founded the Optimal Delivery and Operations System and served as country director at the Breached Center for Impact. Excited and also looking forward to hearing Dr. Abel share his own expertise as well on the Ethiopia front as well as we learn or cross-learn across these different countries today. And last but not least, we have Sylvia. Sylvia who is also she's a physician, sorry, a pharmacist and a digital health expert serving as the digital health technical lead for Kenya's Health Informatics Association, and also the community manager for Helena. And she leads the Africa Regional Knowledge Hub for one of the global digital goods, and supports national digital health policies and development and drives research on data use, digital technologies, and their impact on achieving universal health coverage. Excited to also hear from Silver as well as we walk through this session through today's session. And next, I'll just be handing off to my colleague as well, who would be moderating the session today, and in the person of Izina. Izina, are you on the call today?
Yes, I am. Good evening, everybody. Good afternoon and good morning. I'm going to put my camera on. I hope you can see me. So thank you very much, Obina, for having led the session thus far. And please, DHSA team, can you spotlight our panelists? And thank you, panelists, for making our time today to join us so that we can see our panelists as we talk. And my panelists, please, if you can turn your cameras on if possible, so that it's going to be easy for us to put faces to the names. Hello, Dr. Conley, I can see you. Hi, Sylvia. And Dr. Abel. Awesome. And then I'll add myself to the mix. Beautiful. So this is the four of us. And thank you so much for, once again, thank you very much. And I'm going to start this whole about 45 minutes of conversation. Please take notes, people, if you can, and have your questions ready. You can put them in the chat where we're having the conversation, and you can also hold off and have your fingers raised when it's time for us to ask our questions. So I'm going to start with Ethiopia. Dr. Abel, are you there? Okay, so wait a bit for Ethiopia. Dr. Abel, are you there?
Hello, hello. Good evening.
Good evening. Is it possible for
Yes,
you to
yes,
turn
I'm
your
here.
camera on? Your network seems a bit funny.
Uh, uh, Shaky, yeah. I'm in the middle of organizing an event for tomorrow. That's why
Okay, that's fine. Okay, so
uh,
let's start with you. Is
yeah.
that okay?
Yes, yes, yes.
Okay, so let's start with you and Ethiopia. We know that, or we are learning, or we just learned today that Ethiopia's national e-health strategy dates back to about 2014. Can you share more about what has been achieved so far? How it has impacted communities? Are there any verifiable outcomes, and what challenges have been there since 2014? It's been a while now, about 10 years, 11 years counting this year. So what has been the outcome? How has the impact and any challenges thus far?
Okay, thank you, Izid, for the question. So regarding to our strategy, we have been working on that for the past few years, as you mentioned, since 2014. This strategy actually created the government's first explicit roadmap, especially for e-health. Initially, we are calling it e-health, not digital health. So when you talk about e-health, we're talking about standards because they are the foundation, the governance, because we have to come up with different policies, different the supporting documents, and also we will actually working on the workforce and how we can actually empower our health professionals and other professionals working in these areas. So this was actually in alignment with the WHO document and the WHO roadmap as well. So there are some key verifiable achievements actually which were initially implemented within the country. So if you are aware, we were the early adopters and also implementers for the electronic community health information system. So this tool actually helped us in digitizing the health extension program, which was initially led by our previous director and Minister of the Ministry of Health, Dr. Pedro Adhanom, which is now the director for the WHO. So we were able to change and optimize this health extension program and even through this process, even though we had so many challenges, we were able to increase the data reporting and also the better case follow-up as well. And also we were actually we were able to see a lot of improvements in health extension worker data practice and also coverage. The other one was we are actually working on creating a more of interoperability platform because we had so many tools, but they were fragmented and this created a lot of issue, a lot of mess. So we had to come up with some strategies in achieving this siloed approach. So one was one of the measures we used to reduce such fragmentation was the establishment of national interoperability network and also other efforts. So we were able to incorporate this within the e-health strategy as well. That's when we came up with this. It's not we, but we adopted more of a global standards, like using or aligning with source platform as well. So many tools within the, the ecosystem with different programs. We have to make sure that they, even though they were not initially integrated or they were not speaking to each other, we had to make that, we had to make sure that they had impacts which were more of a positive within the community. And the first one was initially on the primary or community level, where the ECHIS and digitized reporting tools have actually reduced the paperwork, and it has also increased the uh, follow-up and also the timely referrals. And we're able to follow and track even the commodities, especially on the last mile delivery. So currently, through time, we are heading to the more of a unified digital health ecosystem with the multi-tenant EMR, with national ID integration and other tools integrated into a central uh, system. So this actually had a huge impact on our community. Thank you. Over to you, Izzy.
Definitely, you're welcome. I can see that there's been quite a number of verifiable outcomes and impacts made. And I believe that there has been quite a number of strategies, a number of revision of this strategy since 2014. And I'm going to come back to you again on these revisions, but let's move to another country, Nigeria. Dr. Kunle, Nigeria has the Digital Health Strategy 2021 to 2025, and there's also the Digital Health Transformation Roadmap from 2025 to 2030. How were these developed? These strategies developed and roadmaps developed? Which stakeholders were consulted, and what gains have been made in implementing these strategies?
Yeah, thank you very much. I'm sorry, I'm trying to reconnect to my computer. And it's a pleasure to be here. I do appreciate the DHSA leadership for inviting me. Interestingly, I coincidentally stumbled at Albert in Kampala last week randomly at the AI in Health Africa Summit in Uganda. Meeting him for the first time, having connected on LinkedIn. So back to your question about the digital health strategy in Nigeria. The digital health strategy and digital transformation roadmap was developed in consultation with multiple stakeholders. Different levels of consultation had gone on. I don't know if you can hear me. Okay.
Yes, you can hear you.
Different levels of consultation had gone on prior to the development of the framework and also of the roadmap. And interestingly, Nigeria being a very diverse country with multiple streams of digital health expression, from private sector to the public sector, which is government, to the development sector, which are where the development partners and most of the donor funding goes through to strengthen through to multiple siloed tiers of the health system, required a whole lot of consultation. And in the initial phases of it, there were those consultations that went on for a pretty number of years before they arrived at developing the roadmap and the strategy. I've been part of some of these consultations. And one of the things that is key is that it's not just those consultations, it also aligns significantly with the African Union digital transformation roadmap, which focuses on governance, on infrastructure, and upskilling healthcare worker education. And those are very interesting points that do reflect in the realities and the challenges of Nigeria as a nation. One of the key challenges, or what I would call dynamics of Nigeria's own roadmap, would be that health currently in Nigeria do operate in the concurrent, what we call the concurrent list. That means that health is administered at the federal level, at the state level, and also at the local government level, independently or autonomously. So every of those tiers of administration do have autonomy over the health of its people and the decisions that are made by it. But one of the things that the government has done, and I'm not speaking for the government. I do not work for the government. I'm a non-state actor, but interestingly, I also had a conversation with the digital health coordinator for the country this morning. I've also been working with the different teams as a non-state actor over the years. One of the things that does is that it does, split the authority of implementing those roadmaps or having to consult to develop those maps across 3 different tiers. And that's why multiple consultations are needed. And one of the things that do make those work are different institutionalized forums where those roadmaps are ratified, like the National Council on Health, where all the commissioners of health come to the table, all the respective administrators at different tiers come to the table on matters of health or matters of digital health and able to ratify those. And that's what forms like the governance backbone of those kind of policies. And at different times, even up until now, those ratifications had happened. And one of the things that makes it also easy is also identifying persons who represent each of the states as focal persons on those boards, or on those kind of councils, or those kind of consultations that do happen. So interestingly, as diverse as Nigeria is, with a population of about 200 million people across 36 states plus one, there are still significant institutionalized governance-driven forums that do help to make sure that those roadmaps and frameworks are brought to light through various and different tiered stakeholder engagement. An example is the National Digital Health Architecture that was recently concluded, and the Digital Health Transformation roadmap of the government, which was concluded last year. It took a lot of engagement, from regional engagement to national level engagement, to make sure that all the different players are brought into the room, including the private sector player. Nigeria do have a very robust private sector ecosystem. And one of the things that is key is making sure that everybody is able to make meaningful contribution and focusing on what can be aligned, and what cannot be aligned is layered on the strategy. Such strategies such as having to have an architecture or an open HAI framework where everyone can key into. And that's the pathway with which the country is going at the moment. And we're beginning to see, significant successes with that. Thank you.
Thank you so much for breaking that down for us. I'm going to ask you a follow-up question. As this 2021 to 2025 digital health strategy is wrapping up this year, how has it fared, the implementation? How has the implementation of that strategy fared?
Well, I would say that there have been more challenges than we've seen successes. There have been more challenges, and try not to focus too much on challenges. Those challenges have really taught us as a country how to better implement our digital health strategy. And the challenges border around fragmentation being a very big one. Governance is something that we have at the policy level. The states always commit that, yes, they would support the implementation of it. But one of the things that is beginning to happen now is that we're learning to know that Nigeria would only be able to operate and exist and implement moving forward on a decentralized digital governance system. When I say decentralized digital governance system, it means that one pattern of having a single EMR, as it is in some countries, or having 2, 3 EMRs will not work in a country like Nigeria. Even if the National Council on Health did ratified, yeah, there has to be policies. But what has been seen as lessons is that with this integration, with this lack of integration, or difficulty in achieving integration because of the diversity of the country, can we allow everybody keep doing what they are doing, but being able to plug it into one national open exchange system or open architecture? So rather than saying that you want to bridge together, which is one of the things that the old or the digital health strategy, that is to say that we want to have one not like one system, but what is being termed as the rigid interoperability, right? You would be able to make sure that all systems can operate with open standards, and those systems can eventually all feed into one central repository, which is why the national digital architecture was framed and was set up and is being currently being pushed. And one of the key things also that was seen as a key challenge, and like I said, it had myriads of challenges rather than the successes that we can count. But one of the things that we're seeing is that we learned a lot from those challenges. It's been infrastructural limitations, because it also focused on, scaling infrastructure and all that. But even with that, there'd been a lot of private-public sector partnerships that we're seeing in small pocket of places, and we're learning a lot from, and it's currently being scaled across board. So, for example, in terms of infrastructure, we're beginning to see government working together intersectorially or multisectorially. Last month, I also attended what is called the National Power for Health Forum. National Power for Health, meaning that the necessary electrification that will be needed to power primary health centers. And that was a discussion. It was about how do we power maternal health? How do we power immunization? How do we make sure that every woman that needs to give birth can give birth with, the necessary, electrification and power needed in first? How do we make sure that our digital health systems are powered significantly by the right electricity? So, and that's where a lot of stakeholders are come together. I'm talking about the Rural Electrification Agency, the National Communications Commission, the different health electrification programs are come together, and they're looking at, if power is a problem, how can we make sure that we power the critical digital health infrastructure we have or we need across our primary health centers or across our health facility? So we're beginning to see from the learnings of this current strategy, or beginning to see what is possible or what can we do better. Another one is that the strategy also forced everyone to be developing what is called desktop-based EMRs or computer-based EMRs. And now we're beginning to see that there's a need for us to move away from looking at the high mobile penetration in Nigeria of about 92%, according to the Nigerian Communications Commission, that we need to begin to develop what is known as like the mobile-first digital platforms, where digital platforms or digital systems can be mobile, rather than making it highly dependent on being desktop-based or computer-based, or the traditional EMRs that we have, which oftentimes is cumbersome to use. We don't have the required HR to always come to the facility to use it, but by developing like mobile first. So that's kind of some of the lessons that we're learning. There's a whole lot to talk about digital literacy in terms of, empowering the healthcare workers. It's just only about barely 40% of the healthcare workers in Nigeria are able to say that they are digitally capable. And one of the things that we also learned from that roadmap is it doesn't look like a pass mark, but there's a lot of opportunities to upskilling. And upskilling is something that is gradually becoming the focus of the government to see how can we drive digital literacy among healthcare workers. How can we make sure that healthcare workers are, in the days of AI, for example, how can we make sure that they are AI ready? There's AI readiness, a lot of AI readiness discussions going on. Our organization is holding like AI for public health training and workshop in 2 days for like 40 key organizations, including government ministries and all that. And the whole idea is to begin to aggregate the necessary skill set that is relevant to the health worker. We're pulling public health organizations together, all the key ones within the country, all the key parastatals, ministries, departments, and agencies. And we're seeing like all of those aggregating together to create a mobile or digital ready workforce, which we cannot boast that we do have at the moment. So in terms of how the strategy have fared, I would say that there's a lot of learnings, a lot of lessons that we can learn or we're learning as we evolve into this new phase of the strategy. Let me stop there. Thank you.
Amazing. That's quite an insight to the how implementation has fared. So Sylvia, moving on to you now, and Kenya has gotten into the race, the digital health strategy race just last year, when you passed the law into law a new Digital Health Act. So tell us how this came about, walk us through the journey. How did this come about? Does it contain specific financing mechanisms and budgets to improve digital health? So how is the money to get this running going to come about? And what are the provisions of the act that you find most useful in supporting the improvement of digital health? So this is a packed question. Just walk us through the journey, the money, and what's the most useful part of this digital health act that was signed into law recently.
Yeah, thanks, Ezine. It's very nice to be here. Very nice to meet you all. So it's always such an interesting question to get asked, where did this journey start? Because I think having sat with ministries, Ministry of Health team members, they always say this journey started far behind in 2016 when we're talking about the Health Act. And the Health Act in Kenya actually mentions something called the Comprehensive Integrated Health Information System, which came to life in 2023 with the passing of the Digital Health Act. So this is what we are calling the Digital Health Superhighway, which is our representation of what this comprehensive integrated health information system looks like. So this journey started far back in 2016, the vision of how can we use digital health and digital technologies to drive achievement of UHC. But I think there was, I don't want to use the wrong words, so I think I'll use the word incentives. There wasn't the right incentive to actually get digital health on the front of the line. And the thing that actually was a game changer for us in Kenya was the leadership we have in the country. And again, a disclaimer, I don't work for the ministry. I've just had the privilege of working alongside them when we were developing the Digital Health Act. And that was the biggest determinant of us seeing as much progress as we have seen in Kenya with adoption of digital health and having formal policies around digital health. So when the president came into, when he came into office, that this is one of the things he had in his manifesto, that we should adopt digital health as one of the key drivers of UHC. So when he was sworn in and during his speech, he actually explicitly mentioned that one of the things he's taking as one of his initiatives is to have digital health adopted in the country. So when he had that formal declaration during his swearing in ceremony, everything accelerated. So I remember, and I think this is something we can all appreciate, that developing policies takes a very long time. But with the Digital Health Act, it was passed in record time in Kenya. I think we were drafting it. We're having those drafting meetings with the Ministry of Health teams, private sector representatives, ministries of health, development partners, and it was passed in a couple of weeks after the president gave his speech. And from there, it's been like we have seen tremendous efforts being made across the different Ministry of Health teams to make sure that we are actually implementing the law. And one of the things that I think I can appreciate with Kenya's vision for how we are deciding to adopt digital health is that we have something called the Digital Health Agency, which is responsible for making sure that this comprehensive integrated health information system is implemented. So it is responsible for driving digital health in the country. I know this is not the approach that many countries take. It's very, dependent on what preferences you have in your country. For us, we have the Digital Health Agency, which is mandated to drive digital health implementation in Kenya, working closely with the Ministry of Health, of course, but other countries decide to embed all their digital health transformation strategies in the ministries of health. So this is one of the things I can say is a difference between Kenya and other countries, that we have a specific agency that's responsible for digital health driving digital health in the country. And another thing that the Act mentioned is that it explicitly mentioned that health data specifically is a strategic national asset, which I think that is a very big factor now, with knowing how much influence data has in how we think about things, how we envision things. So that's one of the things that is mentioned in the law. And then another thing that is mentioned is that we need to have standards of how we should implement digital health. And that's something that the Ministry of Health has really taken a lot of effort in developing strategies and frameworks, whether it's strategies on how data is governed within the country or how systems are certified within the country, so that all the systems should be able to be integrated within this comprehensive digital health integrated, information system, which we call the superhighway. So all the systems, whether they are public sector systems or private sector systems or development sector systems, all of them have to be linked within this superhighway that we are building. So that's one of the things that the Act really tries to enforce. And when it comes to financing, so there's 4 key financing strategies that we have for ensuring that we have money to drive this vision for digital health. So of course we have the own source revenues, where the government will finance its own vision. We have funds coming from Treasury. We have funds from partnerships or strategic partnerships with private sector. And we have, of course, support from development partners who are contributing to drive this vision within the country.
That's amazing, and that's quite an interesting journey. And one thing that stood out for me was like you said, that incentive, and also having a dedicated agency and importance of health data in pushing this forward. And that's amazing. Thank you so much for sharing with us. And I'm going to come back to Ethiopia, like I mentioned. I have a couple of questions, Dr. Abel, around the fact there has been quite a number of revisions to this strategy since 2014. So I just want to ask, how have you ensured continuity and preventing strategy fatigue? You've had this strategy since 2014. So how have you ensured that this, in spite of how long you've had it, there's been continuity in delivering, even though you revise it, and people haven't gotten tired of it, strategy fatigue, and making sure that all stakeholders are being carried along, and also what is prompting all these revisions? That's in fact the first questions. Why all these revisions, and then all the other questions I asked.
Okay. Thank you, Izin. That's actually that's a good question. We have been working on this strategy on the health, as I mentioned earlier, since 2014. But through time, we had to evolve, and we have to come up with different strategies which actually optimize the previous one. So in digital health, as you know, we have so many tools, we have so many updates, so many innovations coming up. So such kind of evolving technology and updates must be met with strategies which evolve with these technologies as well. So the 2014 document was an early framework. It was not a complete one. So it was more of a foundation. So with new architectures, new interoperability standards, and national digital transformation agendas within the country, we had to update, because it was actually required to update the strategy and add additional content to it as well. The other one is globally, we have different priorities when it comes to health. So we even have the Millennium Development Goals, we have the SDGs, we have so many global frameworks, global standards. So every time there must be an update for every strategy and document especially in our country, we had to we had to update. One of the reasons where we had new strategies, which were called especially the HSTP, and the strategies at that time were required to be well aligned, because initially telemedicine, health information exchange, and other surveillance, the surveillance science, the system was not in place. And the other one is we, as a country, we cannot be siloed or limited to our ecosystem. We have to see and adopt the global and other countries' initiative as well. As soon as we have such kind of updates and revisions must be done, because we are still working with different donor stakeholders and also implementing partners. These were some of the issues or some of the factors that made us to change and update our document. So through this change, we had to involve and make sure that all the stakeholders, be it the donor, the funding partners, implementing partners, the government, private stakeholders should be on the table while coming up with such strategies. So even though the government was leading this initiative and coordinating this initiative, all the stakeholders were included through coming up with different consultations, coming up with different steering committees and technical working groups, and also even in some areas we were able to come up with different groups where they can actually influence such strategies and work with the Ministry of Health. One of the strategies I will mention now is the Ethiopian Digital Health Blueprint, which was initially published in late 2020, early 2021. So we aligned to this one. So the blueprint, when it was designed initially, we had to bring all the stakeholders, especially the academia, the private implementing partners, funding partners, and other stakeholders as well. So this blueprint actually is helping us, even though currently, even though initially the time was from 2021 to 2030, we are currently updating that as well, because initially in 2020 we're not thinking about AI in healthcare and other areas. So we have to actually come up with more of an updated version. Such kind of stakeholder involvement is actually evidenced by publishing this national digital health blueprint. So one of the major issues we are currently trying to tackle with such strategies and making sure that all stakeholders are involved is to have a more of advanced and interoperable ecosystem, as mentioned by my sister earlier, that they have already been working on the superhighway for the interoperability. For Ethiopia, we initially were actually using and more of optimizing the OpenHI and OpenHIM platform for the interoperability. So through such kind of consultations and through different interactions with our stakeholders, we had to go through and see one of the best examples for the interoperability. The country we have been looking into with Estonia's interoperability framework.
where they were able to create that interoperability throughout the other sectors, not only the healthcare. So currently, we are more of working on coming up more of hybrid of central and federated approach, so that we have all the tools, be it in the public and the private, integrated and interoperable with the global, according to the global standards as well. So the other one is making sure it is sustainable and maybe reducing the strategy fatigue is we have been embedding, even though we had to come up with additional strategies, we made sure that all the objectives within the digital health blueprint were embedded within the ministry's other strategies as well. So that we have a more of a comprehensive strategy well aligned with other sectors as well. And we have created a clear and transparent governance bodies with clear mandates. So we have steering committees, digital health lead office, which is a new one, which was established 3-4 years back within the ministry, even though we don't have a separate agency like the Kenyans and the Zambians, but we have been making sure that even though we don't have a separate establishment, that all the objectives for the digital health are aligned with other sectoral services. And we have been focusing on service outcomes, not only the technologies. So having the technologies only was an issue initially, but we have to make sure that all the digital tools, the digital health projects, were aligned to the standards like the blueprint, and also we have created some standards as well, especially on the EHR as well. And the other one is to make sure that all this process, all this achievement is sustainable. We make sure that we had to invest and use the local capacity and bringing on board all these private stakeholders and providing the necessary local capacity, the necessary trainings. We are able to make sure that this was sustainable, and also embedding the academia, using all these universities for capacity building, research, and also training, made it much easier to make sure that all these efforts are sustainable. Thank you, Izzy. Over to you.
Thank you so much, Dr. Igbo, for that detailed answer. What I hear is it's really about adapting to the times. And I also see that importance of having a coordinating body for the digital health strategies is very important. So we're going to move into a conversation that really sweetens my heart, which is around capacity building, and that's what Digital Health Skills for Africa is about. So I'm going to start with Nigeria on this. Nigeria truly doesn't have enough health workforce. We have an inadequate health workforce to cater for the huge population that we have. And digital health tools, as we know, can support health workforce optimization. So briefly tell us what national efforts exist to encourage digital health capacity building and adoption. Briefly, please. You're mute, please.
I'm so sorry.
Yeah, that's okay.
All right, thank you very much, Izine. And to say that we do have very robust, and because this is cross-learning, so it's good to learn what is going on in Ethiopia with the Ethiopia Digital Health Leadership Program, which is inspiring in partnership with Digital Square, certifying digital health leaders across board, which is a very good model that other countries could learn from. However,
one of the things that Nigeria has thrived on significantly well is the very robust health tech ecosystem. As at the moment, the Nigeria health ecosystem has netted in terms of revenue of $45 million in the last few years in terms of being able to drive, different enabling capacities within the ecosystem. And most of the digital health capacity you see in country are migrated or moved from within that private sector ecosystem, touching on government in different ways and forms. Also, one of the key initiatives is also the National Primary Healthcare Development Agency, who is working to develop what is called the standardized digital health curriculum. And that digital health curriculum, the whole idea is to be able to use it to build that capacity infrastructure, capacity framework from across different levels of healthcare worker force. And this is being institutionalized at pre-service and in-service levels. So there are also a lot of efforts to integrate digital health into training for health tech schools, School of Health Technology, also integrating digital health into medical records curriculum across board. And that is gaining significant traction with some schools starting it already and some still picking it up. But like I said earlier on, the health workforce census that was done did put Nigeria about 36 to 40% in terms of Nigeria healthcare workers who is able to use digital tools effectively. But regardless, there's a lot of effort to leverage on existing capacity within the digital health ecosystem, making sure that, for example, the National Primary Healthcare Agency did set up what is called the Digital Hub. The Digital Hub gives an opportunity to be able to drive, digital literacy, digital awareness among primary healthcare workers, from CHUs to nurses to different categories of primary healthcare workers. Most of these are still pretty much in early stages, infantile stages. I just had a conversation with someone to see how can we, within our own hub, be able to support the digital health hub within the primary healthcare development agency, which controls over almost 20,000 primary health centers across the country with different healthcare worker capacity development schemes being instituted. One of the other things is that we've also seen an upsurge in terms of private-led trainings and capacity building to the development sector-led ones. The center stage for government has been the National Digital Health Initiative that was inaugurated, I think, about 12 to 16 months ago, and we're beginning to see traction within that coordinating framework. So now, within each state, there's a state digital health coordinator, and one of the key aims that they do have would be to drive digital literacy. So I'm sure by the time there's the next health workforce census in terms of capacity for to use digital health tools and all that, you see an improvement in terms of how well Nigerian healthcare workers are fed. But one of the things we also want to layer it on is to leapfrog it with AI fluency and in AI literacy across healthcare workers. And we're starting with middle to senior level executives from government to public health organizations. Now, the next level would be to begin to do, clustered AI fluency and AI literacy that will be built on the foundation of AI readiness across those health institutions. So we see a lot of opportunities for growth, a lot of opportunities, while we also strive, like Uganda, who introduces digital literacy in their health curriculum, but we still see a lot of opportunities that are presenting itself to us as a nation and in terms of our digital health ecosystem. Also, we see a lot of traction with with the tertiary health facilities. The tertiary health facilities
like the government, third tertiary level institution, teaching hospitals, federal medical centers, there seem to be a lot of digital literacy going on by deployment of complex EMR systems. So we see a lot of capacity building being done at that level, at tertiary level, and at government teaching hospitals and federal medical centers, we call them. They are like the highest level of healthcare provision institutions that we do have in Nigeria. So there are a lot of opportunities for to be able to leapfrog digital literacy, upskilling of healthcare workers. There's a lot being done by the West African Institute of Public Health and other non-state actors to be able to upskill digital literacy for healthcare workers. But like I said earlier, we have much more opportunities to do more than we've done, and I think the momentum is increased. It will get up for upskilling and building digital health capabilities across board.
Thank you. So that's very promising. I hear a lot of the things you're saying, and that's indeed very promising. And I hope that those actually translate to action. Sylvia, I want to go a different direction with you. Kenya is recognized for mobile innovation. We've heard a lot of beautiful things about what Kenya has done with fintech. So, and how the mobile systems have helped with that. So how is this supporting more advanced digital health technologies for health system strengthening? This marriage with mobile technologies.
Okay, so you're right. I think one of the things Kenya is known for is M-Pesa, which is a digital payment platform that we have had in Kenya, I think, since 2007. It has been a game changer. I think I don't think I even pay anything in cash anymore. We always pay everything with M-Pesa nowadays because it's extremely accessible, even in the smallest villages in Kenya. And that has been revolutionary because even as we were implementing digital health, one of the things that changed last year is that we transitioned from our national health insurance fund to a social health insurance fund. So people are able to pay their premiums through M-Pesa. And another thing that an initiative that I think has been being taken up by multiple countries across the world is that there's a big push to have primary health care as a driver for UHC. So Kenya, of course, has not been left behind, and there's an initiative to have the community health workers take more initiative in supporting healthcare provision in the country. So we have a community health worker platform we call ECHIS. So the Electronic Community Health Information System, and this is supported by the Ministry of Health and the county government. So Kenya has a devolved governance structure where we have the national government and 47 county governments. So the community health workers are paid by both the national and county governments. And we have ECHIS, and the community health workers were given mobile phones when ECHIS was being rolled out in the country, I believe last year. And there was multiple trainings and capacity building sessions for the community health workers to teach them on how to use the devices, how to upload information on the platform. And so they were equipped with all the resources that they would need to go to each household to assist with collecting information in the households. So this is one instance that I believe has been extremely successful in us adopting mobile innovation, because we have extensive reach in mobile adoption in Kenya. I think we're in the 90%, if I'm not wrong. And this has assisted us in making sure that people who are very far from health facilities, there's a community health worker that is able to reach them and access them. And if they have any emergency that requires more complex medical interventions, the community health workers are able to refer them to higher levels of care. So this is one instance that I can say that Kenya has really taken a stride in adopting innovations. Yeah.
That's beautiful. And I'm just going to ask a follow-up question around capacity building. So in these new acts, is there or are there structured capacity building activities like mentorships, fellowship programs, stuff like that embedded in the Act?
Not in the Act itself, but it's an initiative that has been taken up by the Digital Health Agency. They have adopted a cascade model for digital health capacity building, where they have this TOT model where they train a trainer in the counties and empower each county to conduct its own end user training independently. So this is done in partnership with academia to ensure that there is market relevant health informatics courses being supported, and also development partners are actively supporting these initiatives. The Ministry of Health also has something called the Ministry of Health Academy that provides courses. So this is accessible to anyone online, and this is done in partnership with academic institutions. And then I remember when the Digital Health Act was passed, we were implementing a project with one of our partners, Transform Health. And one of the goals of the project was that we would support with capacity building on the Digital Health Act. So we were moving around different counties in Kenya, trying to really sensitize them on what does this act mean now that it has been passed, and what does its implementation, what impact will its implementation have in how health is going to operate moving forward. So initiatives like that are, partner driven, really assist in capacity building on digital health and the laws and policies that are implemented on digital health. And then separately, with Helena, which is the Pan-African Health Informatics Association, we have been working closely with our friends at HL7 Foundation to assist in capacity building on standards. So specifically the FIRE standard, which is the Fast Healthcare Interoperability Resource. So this is an interoperability standard that is being, adopted by multiple countries. So we have been running trainings across different countries. We had one in Kenya, we had one in Botswana, we had one in Rwanda. And initiatives like this assist in supporting capacity building on things beyond just the Act itself, but also important elements of how we can achieve this vision for interoperability of our systems in the country.
Great. And as I'm beginning to see, not really I'm beginning to, but that's also talks about or shows the importance of that digital health agency, and it's been a tool for cascading initiatives or things lined out in the Act. So as we wrap up, please, if you have your questions, please put them in the chat. If you want to raise your hand, indicate that you want to ask a question in person. So our final question goes to Dr. Abel of Ethiopia, which is around capacity building as well. So how is Ethiopia building digital health talent? Are there any success stories you want to share with us?
Okay, thank you, Zin. Yes, but let me classify it into pre-service and in-service and implementation linked. And the last one is actually more of on scaling up the ecosystem. So when I talk about the in-service or the pre-service training, so we have been, as a country, have been working on capacitating and investing on our universities. So one of the major success is the initiative where we're able to, especially with the health informatics school, we're able to teach and actually graduate a lot of young individuals in health informatics, where after graduation, they were actually deployed into different health facilities, especially managing the DHIS2 and other digital health tools. The other one is we have also another success when it comes to the universities where we are currently. Okay, I think there is a background. Okay. So one of our success story is the start of a master's program in health informatics within the University of Gondar. So this university has been a major player when it comes to health information system and digital health in the country. So such kind of individuals actually go straight to the ministry, agencies, and other health facilities to support the healthcare system. The other one is the second one where we provide trainings during implementations, especially with our different digital health systems, especially for the, as an example, for the electronic community health information system. It was more of a blended in-person and online trainings, where we provided training to different healthcare professionals and leaders, and we selected champions. So these champions actually helped us in training other health professionals, and they were focused in different facilities. We have reports recently that we were able to implement the SHIs in 9,000 waradas. Or I'm not sure, we don't have province in Ethiopia, but waradas are more of a primary healthcare level establishments. So out of the 28, then not 28, but 20,000 waradas, we are able to implement more than 9,000. So we developed a curriculum, we developed strategy on how we can use these champions to make it sustainable, and rather than the traditional just bringing all the participants or end users to a place and teaching them. Using these champions, we're able to train while they're back at their facility. And the third one is bringing different private stakeholders. We're able to make sure that it's sustainable. So we have different private companies who are currently supporting the Ministry of Health in providing capacity building sessions and trainings using the standards and guidelines prepared by the Ministry of Health. So this created this circle where we have all the, I'm not saying we are perfect, I'm not saying that we have achieved it all, but it's still in progress, and we are trying to create that circle where all these pre-service, in-service, implementation, and all the stakeholders, this process works in a seamless way, where all the capacity building efforts are sustainable in the coming few years. Thank you.
Thank you. That's quite a lot of success stories and testimonials. Thank you very much for sharing. Thank you all very much, all our panelists, for taking our questions and being very honest and very detailed in your answers. And this wraps up the first part of the panel session. We're going to move into the second session of the panel questions. Please, it's going to be very brief. We have Beckley, whose hand is up. Well, Beckley, you can unmute yourself and ask your question. Please keep it very brief and tell us who your question is directed at.
Hello, can you hear me?
Yes, you can, Beckley.
Okay, thank you so much for the opportunity. So I'm a medical student and a software engineer. I'm attending this event as a Digital Health Week Research Volunteer for Transform Health. And my question is for Dr. Kunle Kakonfo. So Nigeria is an incredibly diverse nation, and currently only Lagos State seems to have any vision as a state government for a trajectory for digital health adoption. This was introduced by the commissioner as the African Digital Health Summit this year. So, sir, in your expertise, what partnerships or initiatives should be our ground zero? Is it innovations as regards electronic medical records, or infrastructure as regards power provision?
Thank you, Osare, I think that's your name, right?
Yes.
For giving me the very difficult question. I did make it very clear. I am a non-state actor, but I do try, and I like your perspective to say what should be our ground zero. The truth remains that getting the right strategy for a diverse nation like Nigeria is very important and critical. Last year at the Global Digital Health Forum, we had like a digital ecosystem stakeholders discussion. And we did the same thing this year too at the Africa Health Tech Summit with the Minister of Health, where we came together and then shared our opinions as experts. And those discussions kind of reshaped how the country was approaching digital health. Initially, there was a plan to say, oh, let's get electronic medical records, one per region, or 6 electronic medical. It was advertised to say, let's get vendors who would come and implement electronic medical record systems. But it became really obvious because I've been part of an assessment that puts digital products that are used for electronic medical records in Nigeria. As at that time, it's been up to 6 years now, about over 400 of it, different types across. Now, during the Health Tech Summit in Kigali a couple of weeks ago, folks were sharing that we have almost about 2,000 different vendors and electronic medical record systems, both mobile-based and desktop-based. Now, the question is that, are there electronic medical records being collected in Nigeria? Yes. A significant amount of data is being collected across health facilities, hospitals. You would see that when you walk into an average hospital in Nigeria, there's a computer that is being used to collect records of patient information across most hospitals, private hospitals mostly. And even most government hospitals are beginning to go in that direction. But the problem is they are diverse and fragmented records, EMR systems being used. So the problem in Nigeria is not an EMR problem or an electronic health record problem. The problem is, how do we make sure that everyone can align using the same standards and using feeding into the same using the same architecture so that I can feed into one national system. And then we have also proposed that, no, let's even try to make sure that at the state level, we have a repository that can pull in all the data together. Now, interestingly, it's not just Lagos State that has an innovation roadmap. Kaduna also has attempted to go in that direction. Ekiti State also has gone in that direction. A couple of states, a few of the states that I'm advising directly are already trying to go in that direction. But I'll say this to you. Now, I'm supposed to speak tomorrow at the Commissioners Forum, and I'm supposed to be talking about digital intelligence and artificial intelligence. Then the minister looked at the agenda and like, oh no, I think this is too way forward and way advanced for these commissioners of health. Why not let's start with the basic things? Let's get the data together. Let's even know the infrastructure requirement. Let's not take them to like level 6. No, so in my own opinion would be for every state to have like a practical roadmap. What's the practical roadmap? So I was invited by one of the regional state commissioner of health to say, come and help me figure out my digital health system. And I want to install social EMR. I want to buy social computers. And I'm like, no, sir, that is not your first problem. Your first problem is even establish a baseline. Health technology assessment. What is the state of your infrastructure? What is needed in the state? Come on, do like a digital, and that's what we're doing for the FCT right now. We're working within a consortium in the FCT to do what is called the FCT Digital Transformation Project. What are the different siloed in supply chain, in HIV, malaria, TB? What are the siloed infrastructure you have? Can you just kind of do like an assessment to know where you are, create a baseline, and then you can know what is required. And that's similar to what I led in doing for Malawi at some point. So it's important that we come back to saying, where are we as a nation? Now, the problem is not EMRs, like I said. At the national level, the problem is governance, which is being like, there's a strong and solid direction in terms of, having that, unified interoperable framework, which has just been rolled out. But at the state level, I think beyond innovation is to know where each state is and what their capacity to move forward is. And whether it's what most of the people are interested in is, what will be the selling point for EMR to me? And one of the commissioners that I spoke with the selling point was you can tighten your revenue, right? You can tighten your revenue through healthcare services by making sure that you invest into EMR. They need to understand those basic things, not for the fancifulness in a country that has, multiple priorities, not saying, oh, come and put digital systems here. No. What is it going to do for you as the Commissioner for Health? What is the ROI on investing in digital health systems? Those are the kind of things that we need to establish, first of all, with them, and establish, do an health technology assessment. Where are we as a state, not as a country, as a state? And I'm sorry to say, Nigeria is diverse and really large. I've traveled, I traveled fairly well across Africa, doing, digital transformation work. And I realized that oftentimes, when you compare countries to country, you need to be sure that you're comparing the very strategic things. The diversity of Nigeria as a nation, 200 million people, each of the state has an average of, 5 to 10 to 15 million. That's what the whole of some African country holds. But what is important is to say that as a people, within the context of our priorities, where are we with digital health infrastructure? Where are we with digital health governance? Then from there, we can set a practical and realistic direction, which is what most people refer to as roadmaps. So it's a lot of effort to get there. And that's why we cannot even benchmark Lagos with some state that their revenue as a state is barely surviving to pay all of their staff. We can't layer on them and say, oh, you have to buy so amount of infrastructure. So one of the things we're also trying to do is to say, what is the digital health investment required per Nigerian state? And what is the responsibility of the federal government? What is the responsibility? What quota of the investment is the state government going to put in? And what will be the local government putting in? And those are like the levels of strategic investment direction that we're looking at, to be able to say, okay, if the state is able to put down so amount, parallel with money from federal government, they will be able to make this kind of progress. And that's so it's not a one size fits all. And we're not looking at EMR. We're starting with each state where they are, kind of using, the whole maturity matrix to be able to move them through. But at the same time, it might be slow, but the government is making its effort. And that's why we have digital health coordination pressing in each of the states. We have states being engaged into signing a pact. And it's also front burner in the National Council on Health that is happening next week. So Nigeria is making progress. It might be slow. Lagos had made leapfrog the progress because of the robust, health tech ecosystem that it has. But other states too are catching up, and they are making, might be like tiny little steps, but steady ones, especially because of the pact and because of some of the iterations going on at the federal level in terms of national digital health coordination.
Thank you so much, Dr. Kunle, for that detailed answer. I hope, Berkeley, you're satisfied with the response. Do we have anything else in the chat or anybody who wants to raise their hand? We're almost at time. So I may have to move this over to our moderator, Obina, to wrap up for today.
Sure. All right. Thank you very much, Izina. And a huge thank you as well to Dr. Kunle, Silver, and Dr. Abel as well for an amazing conversation so far. It's very insightful. Took lots of notes, and also trying to thread the dots and connect the dots across these different conversations as well, and most of which also resonates. From the Nigerian perspective, what I'm hearing is we have an interoperability problem, more of an interoperability problem, and more of also an implementation problem. These technologies are there, but it's how do we think about implementing the right technology within the context of the society that we have within Nigeria, a very diverse one, and which also keeps me thinking about what are the, as we have these conversations as well, trying to learn across countries within Africa. Are there also other countries outside Africa as well which might have experienced similar challenges as well, or have similar context. Not exactly, but similar context that we could also learn from their own previous mistakes, people who had gone through these challenges that we are currently going through. And a quick example would be Canada. Canada also has a very diverse or decentralized healthcare system. They are also going through an interoperability problem as well. And some of these roadmaps towards ensuring that they have a centralized repository can be some areas that we could also learn towards advancing our digital health strategies as well. From the Kenyan perspective, I love the conversation around having that cascade model towards capacity building. But at the same time, what I picked as well, something that struck me why Sylvia was talking about was a research that I had presented at a conference around 5 years ago. I'm just trying to assess the level of e-health within Africa, but using Nigeria as a model in this case. And part of some of the challenges that I identified as well during that research was, how the effect of leadership in advancing digital health transformation. But from Sylvia's own perspective, this gives a very good case study as to how, having the right leadership can help fast track fast track the trajectories of these advancement and transformation. And then to Dr. Ebel's conversation as well on the Ethiopia front as well, these different conversations all pulling together to tell us that yes, there is work being done. Africa is not just sitting on the rear view in this as these digital health transformations are going on globally. We are also taking, the right steps in the right direction. And just like Dr. Kunle had just rightly mentioned right now, it might be baby steps, it might be very little tiny steps, but when you take a holistic view, like what we are doing today, you begin to appreciate the impact of these different works and how they how put together they help us get us one step closer towards that ideal world we want to see, which is a connected and equitable digital health ecosystem in the near future. So thank you very much again to everyone who have joined us today towards this conversation today. Again, this session is brought to you in partnership between DHSA and Healthlytic. And if you would like to learn more about the work they do, you can feel free to visit their website and their email. A recording of this session as well will be provided to all registered participants, sometime later on down the line. But again, thank you all for joining us today. And I think that brings us to the end of today's session. Isn't it? Before we close, anything from your end?
No, thank you all for being here. I hope you all found this helpful one way or the other. And thank you to the panelists, and thank you, Bina, for guiding us through, and have a lovely day, everyone.
Sure. All right. Bye.
Bye.